Hi, I'm Alec Martinez with Home and Rehab, and today we're going to be talking about ankle sprains. While a very common injury, one of the first things we always want to rule out is fracture. For people who've had a traumatic injury, even as non-traumatic as stepping off a curb, injuries can be relatively severe. So we always want to test, first off, are any of the bones in the area tender to palpation, which means when I poke it, is it painful? Things like the large bones, the malleoli on the outside of your foot, or some of the small bones within the midfoot, may be an indication that you may be appropriate for a fracture. One of the other ways we'll check is we're going to ask you to try and walk. If both at the time of the injury and in clinic you have a very difficult time walking even 4 steps, that is an indication that I'd like to at least check and see if there's a possibility of fracture. There's not always a guarantee, but it is something I want to rule out. For people who do have a diagnosis of an ankle sprain or we have ruled out a fracture, one of the things we're going to test next is how you walk. Old wisdom used to tell us that we should always rest our ankle, but as it turns out, one of the best things we can do for a sprained ankle is gently move it. So we prefer the term now optimal loading, which means trying to walk in a way that doesn't produce a limp. So if you need to use crutches, canes, sticks, or walkers in order to walk without a limp, that's great. I would rather you use that and walk without limping along in a weird, uneven fashion, but still apply a little bit of load so that the ankle begins to relearn the things it needs to do. For people who can't weight bear at all but do have a standard sprain, we'll begin with attempting to try and increase the amount of loading by weight shifting onto the ankle and eventually starting to practice things like balance. For people trying to return to athletics and sport, we'll encourage people to eventually progress to ankle strengthening beyond balance by using resistance bands or calf raises, and eventually progress to activities like hopping, jumping, and jogging. You'll find that the more you slowly reintroduce activity, the more you're able to do, and you want to only introduce the activities that do not cause sharp pain. If you are producing sharp pain and do have any questions about this, of course you can ask a physical therapist or your doctor whether or not what you're doing is too much. As you begin to return to sport and reintroduce cutting activities, speed changes, and long jumping activities, you may find that you have to go at a lower pace and produce lower reps than you used to do. And that's okay, you'll just find that you have to rework back into that way. If at any point during your own recovery you feel you need to talk to a therapist, of course that's always an okay thing to do, and feel free to give us a call. Have a great day.